Hello everyone. I am Dr. Priya from Bejoho and I'm very happy to say that one of our patients from Bangladesh, Ajiza, has seeked our help to get rid of her headache as well as a discomfort that she's been feeling since years in her nose. So the patient came with a chief complaint of pain in her head, that is, she had severe headache since years and also very much difficulty in breathing. So once she came to India, we introduced her to our ENT expert, Dr. Avinash. So Dr. Avinash is an ENT expert and he will be taking care of Ajiza from now on. So introducing Dr. Avinash with us. So sir, since you have met Ajiza, so what do you have to say about the case?
Okay, first of all, thank you. Aziza, she came to me a week back and she came with nasal obstruction, nasal discharge, and she also came with intense headache. So what I did examination of her nose. I did anterior rhinoscopy and diagnostic nasal endoscopy to see the condition of her nose. And what I figured out that her nose was deviated on the left side. It was a gross deviated nasal septum. In fact, it was an impacted DNS which was pressing on a lateral wall. And because of this, she was having nasal obstruction, nasal discharge, and also intense headache. So we planned to operate on this patient and we planned to do something called a septoplasty in which we have to remove the deviated part of the nasal septum. So we are planning to do it tomorrow. All the pre-anesthetic checkups have been done and tomorrow is the OT.
Okay, so tomorrow we'll be operating on Ajiza and hopefully the patient will be discharged within
Within 24 to 48 hours.
48 hours. Okay, so hopefully the patient will be discharged successfully in 48 hours and then we'll get back to you with what has happened later on. We all know that treatment is very important, but what we don't know is patient counseling is equally important. Why? Because before the surgery, before the treatment, the patient has a lot of questions, a lot of doubts in her mind. They want to ask us, but they are nervous. Sometimes they have questions like, is it going to be painful? Is it going to be very hard on them? Is the doctor going to use anesthesia? Yes or no? So there are a lot of questions that goes on in a patient's mind. So to ease the process, we prefer a patient counseling by the treating doctor himself so that the patient can ask whatever they have with the doctor and the doctor answers, and that not only gives the patient peace of mind but also a sense of satisfaction to undergo the surgery. So here is our doctor counseling the patient, a patient who's going to undergo septoplasty.
So Aziza, we are going to operate you in some time. Any questions you're having? Are you feeling nervous?
Yeah, a bit.
Okay, you don't have to feel nervous. Just tell me what are the questions that you need to ask.
Is it going to be very painful after the surgery?
No, not at all. Because we are going to operate under general anesthesia.
Yeah.
So you will not get to know anything about the procedure. It is not painful.
After the surgery, swelling.
After the surgery, your nose will be blocked
Acha.
for 24 to 48 hours. And after the surgery, we'll remove it after 24 hours. And then your nose will become patent completely.
Okay.
I'm here with the good news, and the good news is that the surgery has been done successfully. So let's hear it from our surgeon, what he has to say about the surgery. So Dr. Avinash, would you like to tell us about the surgery, how it went?
Yes, so we operated on the patient. We did something called a septoplasty with functional endoscopic sinus surgery. Now, it is totally an endoscopic surgery. It is scarless surgery. And whatever we do with endoscope and from inside of the nose. So there is no scar mark that is visible outside the nose.
Okay.
What we did is we gave an incision and we removed the flaps. We removed the deviated part of the nasal septum and also the bony part of the nasal septum. And after that, we sutured the flaps back.
Okay.
We have inserted Merosil pack, which is the nasal pack, and it has to be removed after 24 to 48 hours. So she'll have slight difficulty for first 24 to 48 hours because the nose, there is complete packing of the nose and she has to do mouth breathing.
Okay.
But after the removal of the nose, she is absolutely fine.
So how long will she take to recover from this?
As soon as we remove the nasal pack, she'll be fine. And
She'll be
within
fine.
3 to 4 days, she
So
can.
there will be no scar on top of the nose.
No scar.
Nothing,
It is
absolutely nothing.
scarless surgery. It is endoscopic surgery completely from the inside of the
Great,
nose.
great. So is that the specimen?
Yeah, this is the specimen. We have removed the deviated part of the cartilage and also the bone.
Does that also need to go for biopsy or anything?
It is not required because there were no mucosal changes, there were no polypoidal changes, only the deviated part of the cartilage and the bone.
Okay.
So I don't think it is necessary to go.
So are we all good, sir? Is she feeling better?
Absolutely, she is fine.
Yeah.
She'll have slight difficulty for 24 hours because of the nasal pack, but after that she'll be
So
absolutely.
now we'll shift her to ward after 2 hours?
Yeah, after
2 hours.
2 to 3 hours, you can shift her to the ward.
And then we'll discharge within 48 hours.
Yes, absolutely.
Okay. So here is the good part. Ajiza is feeling absolutely fine. The deviated nasal septum is now removed. She can now breathe freely without any problem, without any headache. So she can go back to her routine life. So the surgery is done and she will be going home in 48 hours. If you are someone who's facing the same issue, please send us your reports immediately to get rid of the headache that you're facing, or if you're facing any difficulty in breathing. Contact Bejoho for all kind of services. Take care of your health. Let Bejoho take care of you.